Hello, I'm Jeff Bendix, Senior Editor of Medical Economics, and I'm speaking today with Gina Kraus-Vilmer, President and CEO of Upwardly Global, an organization working to eliminate employment barriers for skilled immigrants and refugees and integrate this population into the professional U.S. workforce. Gina brings more than a decade of experience in the for-profit and nonprofit sectors. She has worked alongside governments, the UN, and corporations to develop and implement ways for refugees and immigrants to integrate into the workforce. At the humanitarian organization HIAS, she built the agency's economic integration programming for both the U.S. and internationally, while developing partnerships with the public and private sectors. She has led Upwardly Global since 2018. Currently, there are about 165,000 internationally trained professionals living in the U.S., with the range of relevant education and skills to work in the healthcare system. But barriers such as state licensing laws, misunderstandings of credentials, and limited professional networks prevent them from contributing to their full capacities. Gina, thanks so much for joining me today. And I'd like to start by asking, how can healthcare professionals trained elsewhere help to ease the shortage of physicians and other health professionals in the U.S.?
So first off, Jeffrey, let me just say thank you for having me join. This is such a critical topic of conversation. To answer your question, I think it's important to first understand that the healthcare sector was already strained pre-COVID and was in a position where it wasn't able to meet the needs of our aging population in the US, particularly in rural and underserved areas and communities. Analysts had predicted at that time a shortage of 122,000 physicians by 2032, as an example. What we're seeing now with COVID is sort of an exacerbation of those sort of shortages in our system. And we have seen sort of across the country elected officials making a call for healthcare workers to come out of retirement, to have students start serving early. And we really believe that immigrants have a critical role to play in COVID response and have had a critical role to play for a very long time in supporting our healthcare system. So as we're looking at sort of this COVID-related world, we're really seeing that healthcare workers are not only, internationally trained healthcare workers are not only able to meet sort of the growing natural need of our healthcare system, but also especially in this moment, supporting with testing, tracing, developing vaccines, and all kinds of other positions. You had mentioned that there are 165,000 internationally trained healthcare workers that are unemployed or underemployed in the United States right now. That means people who are here with valid medical degrees from their home countries. They spent the long, hard, costly time to get educated and licensed in their home countries. They come to us at Upwardly Global, having on average 7 years of experience, work experience from their home countries. They are work authorized in the United States. Oftentimes they come here either to reunify with family members who are Americans through the diversity lottery system, or by seeking asylum or refuge from their home countries and coming to the United States to restart a life. And they have qualifications. We have doctors and nurses, for example, who have served in multiple pandemics, whether it was Ebola or the swine flu, and are very much ready and able to serve. I think the other piece that makes this population unique is that they have linguistic and cross-cultural skills that are so critical to be able to provide care to an increasingly diverse US population. And in particular, as we see the impacts of COVID really taking a strain on lower income and immigrant communities, it's very important that these people are able to serve and contribute. When we did a survey of our 325 professionals in our network that we have today, 94% said that they were willing to step up and work in the healthcare response capacity, because it demonstrates a real desire for people to be able to contribute at this time. The folks that we spoke to really articulated this idea that they had given an oath to save lives and really feeling frustrated and sad that they were sitting on the sidelines and unable to contribute. So I think from our perspective, we see that there are healthcare professionals that are able to serve. They are work authorized in this country, and what they face are some of these barriers to really contribute at this time, but that there is an existing and a growing need, both pre and post-COVID.
Talk a little bit more about the obstacles that people with foreign training face in becoming licensed to practice in the U.S.
So to be, so there are many barriers to occupational licensing in the U.S. The process is both long, expensive, and time-consuming. Many of the people who come here who are internationally trained and starting a new life oftentimes have no professional network or no very limited social networks. They aren't sure how to navigate the system because it is highly licensed and it is specific state by state. And they are oftentimes working survival jobs in order to put food on the table. So their capacity to save money in order, for example, for physicians to take the USMLE takes quite a bit of time. So we know, for example, if we take the process of doctors, not only do you have to get your license re-credentialed from your home country, you need to take both step 1 and step 2 of the USMLE, which costs on average about $2,000. You need to have clinical experience. Getting clinical experience in the US makes your application for residency much more marketable. And in order to get clinical experience in the US, you need to have a relationship with a clinic or a hospital or a physician who's willing to set you up on a volunteer capacity to get that experience. So if you don't have the professional networks and you don't have the funds immediately to retake all of those exams, and you aren't able to commit to the time in order to do it, it can be it can be prohibitive. So on average, if you wanted to relicense as a physician, meaning you had a license in your home country and you're getting relicensed here, you not only have to take the exams, get the clinical experience, apply for residency, and then do 3 years of residency, you're going to need access to the funds and the professional networks, as well as the understanding of how to navigate through that system in order to get to the end line. The people that we work with end up working in minimum wage jobs when they first come to the US, as cashiers, as rideshare drivers, as clerks, as security guards. And then they face several of these challenges. So for example, we have a nurse from Tunisia who now lives in Chicago, and she's working pretty long hours as a rideshare driver. And working those long hours prevents her from being able to study, but also to be able to save money that she needs in order to relicense. And that's the same story we have with another gentleman. He's an anesthesiologist from Afghanistan. He's now working as a phlebotomist in Virginia. And he's back in the healthcare sector, which is incredible. He's contributing at this time, which is incredible. But he's earning $17 an hour. And he has literally saved for years to be able to afford to take all the steps of the USMLE. And that's just the first part of the process. And I think that the other data point that kind of characterizes the challenges for this community in particular is that 85% live below the poverty line, right? So 85% of the doctors and nurses and other healthcare professionals we work with actually live below the federal poverty line and are trying to make ends meet, and at the same time trying to navigate back into their profession, which is a challenge. So one of the things that we do and that we have found is incredibly helpful for this population is really providing them with coaching and navigation around how do you relicense, how do you make connections to build back your professional network. And then once you get to the point where you're applying for a residency program, for example, how do you polish your interviewing skills so that you can be competitive. I'll also say these are traditionally, they have been very competitive jobs. So really, they're on the flip side, from the employer perspective, is a real need to understand how do you evaluate somebody with a degree from a foreign country? How do you evaluate someone's work experience? How do you look beyond sort of maybe some of the cross-cultural barriers of how somebody communicates? in order to assess how competitive they are. And I think this part of the diversity inclusion piece, by looking at individuals who are currently here, who are looking to compete versus people who are applying abroad looking to compete into residency programs, is something unique and different that employers need to adapt to. And that's also part of what we do, is working with employers to
How do
understand that.
healthcare professionals and the organizations that represent them, how do they regard these professionals trained elsewhere? Do they see them as competitors? Do they see them as less qualified? How do they see them?
I think um, I think I think the idea is that what's the barrier for many employers is this idea of diversity and inclusion in hiring. Um, it's not the biggest barrier. It's really simply that they don't know how to access the population. There's a lot of confusion about what it means to have a degree from a different country, what it means to be work authorized. Many of the questions we get is, does this person need to be sponsored, right? And so I think for a lot of hospitals and healthcare employers, there is this understanding of internationally trained, but understanding them as actually being from their home country, wanting to come here for the job, versus understanding that we have to American citizenship who are here already, who are trying to access these opportunities. And so I think part of it is not really understanding who this population is and the confusion around that and their work authorization, and then really how to access them and interpret sort of their degrees being from different countries and how they represent themselves in the interview process or through written examination and things like that.
Does Upwardly Global work to try and clear up some of those misunderstandings?
Yeah, we actually work a lot with employers, and one of the biggest questions is, are these people work authorized, and how do you understand work authorization? The other piece is, how do you understand people's credentials and licenses? Obviously for nurses and doctors, it's different because they have to be licensed if they want to be applying for a nurse or physicians as a doctor. But for other medical professionals who might choose an alternative pathway, who may not want to be relicensed, but may want to work as medical interpreters, as community-based healthcare professionals, as clinical researchers. It's really building sort of a language and a cultural awareness around who these folks are and what their contributions they bring, and how do you interpret that, their experience and their skills, and fit them into the employment system.
Mhm. Why is it important that the U.S. diversify its healthcare workforce?
I think COVID has really taught us that we need a workforce to be nimble and to be able to adapt and respond to disruption. And I would say there are countless studies that demonstrate and link diversity to improve problem solving, innovation, adaptability. Many of the people we work with have served in crisis or in conflict, have served in other pandemics. So they bring a skill set that's unique. I think the fact that they're a diverse and resilient population is something to add to sort of the overall healthcare system. I think we recognize that we have a healthcare shortage, and there are people here who have the capacity to serve and serve pretty much immediately, is critical to understand. And then I think the fact that they have this language and cross-cultural skills to really deliver culturally competent medicine in an increasingly diverse population, and against in populations who oftentimes are least served, is also critical at a time where we're really looking at improving patient outcomes.
Well, that certainly makes sense. Do healthcare professionals who come here, are they aware of some of the obstacles and barriers that they're going to face when they do try and practice their skills in the U.S.?
I would say yes and no. I mean, I think, I don't think most folks when they come realize that each state has differences in terms of their licensing. So that's something that they have to unpack. I think lots of folks feel like if they have a relevant degree from their home country, that it can be easily translated. And even recredentialing at times, or even applying for a license, can be cumbersome because there isn't any standardization and parity in how foreign, internationally trained physicians or doctors or nurses or healthcare professionals degrees are evaluated by various boards. And so that can also take a lot of time back and forth, require a lot of documentation that has to be secured from their home country, from their home schools, etc. And I don't think a lot of people are able to unpack that before they arrive and start looking for work. I think there's the piece of how do you relicense, and then there's a piece of how do you be competitive in the job market. And the competitive piece is a whole other beast, so to speak, in terms of how do you communicate in a way that translates very well to a US employer, whether it's firm handshake, eye contact, using the I form, talking about what your personal individual contributions are versus what the group's or the team's contributions are. And I think people don't recognize how costly it is and how long it will take them to get back on the path.
What are some of the legal or policy changes that need to occur to make it easier for these foreign trained professionals to practice in the US?
Yeah, I mean, I think we think it's possible to build more accessible, streamlined licensing processes, open the redundancies. We did see movement on this pre-COVID, where you had states really trying to address sort of the shortage of physicians in particular in rural areas. And so I think there was positive movement around that. For example, Missouri created a assistant physician's license classification for foreign trained doctors who passed required sections of the USMLE, but hadn't yet completed residency. So that I think was a meaningful step forward. In COVID response, one of the things that we have seen is governors really taking the lead through executive orders in order to increase the access for internationally trained doctors to be serving at this time. And that's been really arranged. So I think from New York, we saw on one side, giving flexibility to these internationally trained medical graduates who are already in residency programs, right? So they already met some of the barriers in order to get into the residency program to reduce the requirement from 3 years of residency to 1 year. And then on the other side, we've seen states like New Jersey who are issuing temporary licenses to internationally trained physicians who have practiced for 5 years in their home country, are in good standing, and have clinical experience within the past 5 years. So I think there's been movement around that. I think the real issue is how do we make some of this more permanent? And not only through executive order, and not only one or two examples of states trying to move the bar on this. A couple of things that we think are meaningful would be ensuring accessibility. So ensuring states have accessible, clear licensing guidelines available to internationally trained medical graduates. They invest in career counseling programs and navigator models to help these folks navigate through the system as they apply. So programs like Upwardly Global. I think providing funding for dedicated residency spots for internationally trained medical graduates in states would be incredible. I think scholarships or waivers for licensing exams for both nurses and doctors in terms of removing that fee barrier for folks would be meaningful. Some states have already started this, but task forces, so convening a task force with representatives from the healthcare system, higher education, nonprofits, government, to examine these barriers and make recommendations on what each state can be doing to remove some of these barriers. Virginia, for example, has already started this. And I think that's incredibly meaningful. And then we know that, to build a more streamlined licensing system, that's not going to happen overnight. But there's still other ways healthcare professionals can get involved in this work. So at Upwardly Global, we created a portal called Healthcare Connect to connect internationally trained professionals with employers who need their skills at this time. So for that, log on to upwardlyglobal.org to register. I think for doctors or physicians or healthcare providers that are listening to this, to open your networks, to be mentors or to support informational interviews or to help secure clinical experience would be pretty meaningful. And I think for employers in HR departments of hospitals or clinics, getting better understanding of this population, and encouraging partnerships with local organizations like ours in order to help understand who these folks are and help create a linkage in a pipeline so that they're starting to benefit from this talent pool that's already here.
Okay. Well, great. Thank you very much. This has been very helpful.
Thank you, Jeff. And don't forget to check out the websites of these MJH Life Sciences brands and more to get additional information across the medical field.